Hello everyone, how are you? I hope everyone is doing good and well. Let's talk about the diabetes. Diabetes is a very hot topic nowadays, and why it is hot? Because India is capital of the diabetes in the world, and it is a diabetic epidemic. Almost 7 crore population of India is suffered from the diabetes, and more in that also the 90 to 95% is suffering from type 1 diabetes or juvenile type of diabetes, which is insulin dependent, in which there is a complete absence of insulin in the body and we have to give it externally, and it occurs in adolescent population, and in long run it produces very impact. And type 2 diabetes, which occurs in adult population, and it is mainly causes are lifestyle, related to the lifestyle, and they are like eating unhealthy food, having stress, and not having the physical activity, in which unhealthy food people eats mainly like salty, processed food, soft drinks, which contain the highest amount of sugar. And diabetes is basically the disease of the calories, and it is not the disease of the sugar. When there is a good balance between the calories intake and expenditure, there is no question of having the diabetes. But in type 1 diabetes, there may be the reasons like immunological, genetic, and idiopathic, which science is still discovering, and it is not yet confirmed why it is forming in some individuals. In that case, we can't help. But in type 2 diabetes, it is mainly due to the lifestyle, and so we have to work on it, and it is in our hands that we can prevent. In diabetes, there is a mainly iceberg phenomena, or many times a 50% population don't know whether they have diabetes or not, because they are preclinical, or symptoms are not shown until it progresses for very long time. So it is necessary to do the blood testing regularly. In type blood testing are of two types, that is a fasting and postprandial. In fasting, there are 7 to 8 hours fast is done, and then blood tests are done. If patient is non-diabetic, then blood sugar level should be less than 110. If it is a pre-diabetic, that is 110 to 126, and diabetic greater than 126. That this blood sugar levels for the fasting. But if in postprandial case, that is 2 hours after the eating, then that time non-diabetic blood sugar level should be less than 140. Pre-diabetic 141 to 199, and diabetic is greater than 200. Type 2 diabetes is majorly can be controlled, or it can be reversed. Non Patient can get reversed from diabetic to pre-diabetic and to the non-diabetic. Yes, it is possible, but patient has to take the efforts for it, make changes in lifestyle, have a healthy food, add physical activities in life, and minimize stress, do meditation, or find out the ways to deal with stress, or have a good mindful state of mind. And in healthy diet, 50 to 55% can take a carbohydrates, and remaining half of quantity can be divided into the fat and protein. In fat also, it's better to take unsaturated fat and have a healthy fat. Thank you so much.